We will lead by science. Protecting the health and safety of the American people is the most important job of any president. And unfortunately, this virus laid bare the severe shortcomings of the current administration. Public fears are being compounded by pervasive lack of trust in this president, fueled by adversarial relationships with the truth that he continues to have. Our government's ability to respond effectively has been undermined by hollowing out our agencies and disparagement of science. And our ability to drive a global response is dramatically undercut by the damage Trump has done to our credibility and our relationships around the world. The World Health Organization now has officially declared COVID-19 a pandemic. Downplaying it, being overly dismissive, or spreading misinformation is only going to hurt us and further advantage the spread of the disease. But neither should we panic or fall back on xenophobia. Labeling COVID-19 a foreign virus does not displace accountability for the misjudgments that have been taken thus far by the Trump administration. Let me be crystal clear. The coronavirus does not have a political affiliation. It will infect Republicans, Independents, and Democrats alike, and will not discriminate based on national origin, race, gender, or zip code. It will touch people in positions of power as well as the most vulnerable in our society. First, anyone who needs to be tested based on medical guidance should be tested at no charge. At no charge. The administration's failure on testing is colossal. Secondly, we need to surge our capacity to both prevent and treat the coronavirus. And we should establish hundreds of mobile testing sites, at least 10 per state, and drive-through testing centers to speed testing and protect the health of our workers. The President should order FEMA to prepare the capacity with local authorities to establish temporary hospitals with hundreds of beds in short notice. The Department of Defense should be planning now, should have been planning, to prepare for the potential deployment of the resources provided, medical facility capacity, and logistic support that only they can do. In a week from now, a month from now, we can need an instant 500-bed hospital to isolate and treat patients in any city in this country. We can do that, but we are not ready yet, and the clock is ticking. Thirdly, we need to accelerate the development and treatment of a vaccine. Science takes time, and when a vaccine is ready to go, it should also be made widely available and, again, free of charge. By cutting our investment in global health, this administration has left us woefully unprepared for the exact crisis we now face. No president can promise to prevent future outbreaks. But I can promise you this: when I'm president, we will be better prepared, respond better, and recover better. We'll lead with science. We'll listen to the experts. We'll heed their advice. And we'll build American leadership and rebuild it to rally the world to meet the global threats that we're unlikely to face again. You know, and I'll always tell you the truth. This is the responsibility of a president. That's what is owed the American people. Now, in the difficult days ahead, I know that this country will summon the spirit, the empathy, the decency, and the unity needed. Because in times of crisis, the American people always stand as one if told the truth. Volunteers raise their hands to help. Neighbors look out for neighbors. Businesses take care of their workers. So we'll meet this challenge together. I'm confident of it. But we have to move, and move now. Thank you all for taking the time to be here, and God bless our truth.